acute limb ischemia, this is a clearly stable patient assessment. So we're going to use what? We're going to take the whole history, then perform the whole examination, then discuss diagnosis and the management. How does acute limb ischemia present? With a leg pain. So what you're going to do, you're going to take the Socrates, of the leg pain, and then you're going to do the differential diagnosis. So Socrates for the leg pain, the differential diagnosis. What are the differentials? Cellulitis and redness and fever, DVT, okay, and a recent traveling, recent operation, any swelling in your calf, okay, trauma, any chance could have hit yourself, okay, an acute limb ischemia. Now you would have already looked at the monitor and show there is an AF, so that tells you touch the cardiac history as well. Any heart problems, any heart attack in the past, any palpitations. This particular patient is experiencing thumping in the chest. You look at the monitor, then you can say the monitor shows you have an atrial fibrillation, simply an irregular heartbeat. Can I feel for the pulse? What is taking the history? You can feel for the pulse and ask the patient, do you have any high blood pressure, high blood sugar, any heart problems in the past? So you have to touch the heart problems. Okay. Now, you finish the history. You need the maftosa, the ice. Okay. Then you're going to do examinations. Your examination will be targeting the 6 P's of acute limb ischemia. Okay. The first P is pale. The first P is pale. When you inspect the leg, either the left or the right leg, one leg is going to be pale. The second P is perishing cold. Okay. Perishing cold. You have to touch with the back of your hand, both feet, but it's difficult to make the mannequin cold. So you can say there is no perishing cold. Do not make things up. It will be pale for you. If it's cold, it's cold, but usually the mannequin is not cold. So there is no perishing cold. Okay. The next is pain. So you have to palpate. And when you palpate, you're going to find there is pain in one of the leg, left leg or right leg. The next thing you're going to do is paresthesia. Okay. Paresthesia. Okay, paresthesia. So you ask the patient, any tingling or numbness in your leg? Yes. Okay. Is it in right leg or left leg? In my right leg, for example. Okay. And then you use your hand to touch. Can you feel me touching you? Yeah. Can you feel me touching you when I do this? Can you feel me touching you? Yeah. He will be able to feel on one leg, but not to feel another one. Okay. So there is paresthesia. The next one is paralysis. Paralysis. Okay. So, are you able to move your left leg? Are you able to move your right leg? You won't be able to move one leg. That is paralysis. And the last P is pulseless. Okay. Pulseless. Check for dorsalis pedis, check for posterior tibialis. And in this particular case, what you would find, there is absent pulse on one side. Can you feel the pulses on the mannequin? Yes. You can feel the radial pulse. You can feel the dorsalis pedis, the posterior tibialis. You can feel the carotid. All the pulses are there. But in this case, because an acute limb ischemia, there will be absent pulses on one leg. So they're the 6 P's that you are targeting on examination. What you also want to do is to look for a stethoscope and tell the patient that I also want to examine your heart because the monitor shows an atrial fibrillation. I want to listen to your heart. Are you experiencing any palpitations? Yes, he has got a thumping. Okay, the examiner may tell you, do not perform cardiovascular examination. Then you go to a diagnosis and explain to the patient what you have is an acute limb ischemia. What this means, because you have got an atrial fibrillation, which is an irregular heartbeat, a clot has been formed in your heart, and that clot has gone to your leg and has caused blockage of blood supply to your leg. The blood is now not flowing very well to your foot. It is a serious condition, okay, because you could lose your leg. Okay, so the condition is called an acute limb ischemia. Yeah, so what we need to do, management, we need to immediately refer you to the specialist, the vascular surgeon. Okay, what the specialist might do, may perform what you call an embolectomy to remove the clot in your blood vessel that is blocking the blood supply to your leg. Okay, so this is very urgent. In the meantime, I'm going to give you some paracetamol, for the pain, give you analgesia, I would advise not to eat or drink anything because you might need to undergo an operation. I'll also request for investigations, routine blood testing, your type of blood group as well. We're going to be wasting time. We're going to get now straight away and send you to the specialist, the vascular surgeons. Please don't mention some other investigations in here that will waste the transfer to the vascular surgeons. Okay, but the patient is stable, and that is how we would manage this particular case.